There's nothing invasive here. You're not putting magnets in the brain. You're not putting implants in the brain, which are fine to do if you need to. And there are things
there are indications for that,
that are indications for that. But this is much safer than that. And you're talking about mapping the brain, locating this area with an fMRI, correct?
Yeah, so we use a GPS system, a targeting system using advanced MRI and fMRI to locate the specific node and where exactly it is, because you want to direct the magnetic field, which is an external magnetic field outside of the head. It's, as you mentioned, nothing invasive, but the magnetic field can be targeted to within 2.5 centimeters from the skin surface, and also the epicenter you would like to target the specific area you want to treat.
So you put a
head holder with a device which has on it a GPS system. We have the 3D, the X, Y, and Z coordinates, north, south, east, west, plugged in electronically into the head holder, and you have an image that you can see where the epicenter is, and then you concentrate, or you angle your head holder so that the sweet spot of the magnetic field is over the area of the brain that you want to switch off or on, and to get more into rhythm with the brain's natural default mode network.
Okay. And so you then start putting magnetic impulses.
It switches on and off a magnet. So it's an electromagnet that switches click, 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 click. You know that noise in an MRI scan? It's just the same as an MRI magnet, except within a small device. And it changes the magnetic field within the tissues. If you remember from high school physics, if you have a magnet switching on and off, and you have fluid in that field, you'll create a current. So what we're doing is creating a current in the wires that represent the white matter wiring in the brain to switch it on and make it rhythmic rather than firing in a way that's incoherent.
How long does the treatment last, and how often do you have to do it, and for how many days in a row?
So there's a huge breakthrough. TMS started in 2010, around 2010, and the treatment required one treatment a day of an hour a day for 30 days.
Right.
And now, since about 2.5 years ago, and now finally FDA approved, is the theta burst concentrated TMS, where it's just 3 minutes. Takes 3 minutes to do what used to take an hour, and you can do 5 of those treatments in one day. So that rather than having treatment for a month, you can get a full course, 5 treatments a day for 5 days.
Okay, so this 3 minutes, 5 treatments a day for 5 days.
For 5 days.
So you're talking 15 minutes a day.
Separated over a couple of hours, yeah.
Sure. But we're talking about 15 minutes of treatment a day, spread out throughout the day for 5 days.
5 days.
And what's the efficacy?
80% of people with this treatment feel much significantly better, as opposed to just over 60% before. So there's a huge improvement in efficacy.
80% of the people have a marked improvement in depression and anxiety.
Yes.
And this is without pharmacology. They're not on medication.
Right.
And on follow-up, 30 days, 60 days, 90 days, what's the longevity?
The durability is very good. This is the work that's going on now. We've been doing this only for 2 or 3 years now, but it looks from all early reports that it's as or more durable than the traditional treatment.
Yeah, it's the precision that's making the difference here,
that's
right?
Right. I think it's 2 parts. It's the delivery of this theta burst, a more concentrated, powerful, I think that's the right term, without having biologically negative side effects, as well as the fact that we can see the abnormality better with advanced imaging and fMRI to specifically target the area rather than the general region.
Yeah. There are people suffering with depression and anxiety that is debilitating. You know what I'm talking about. People that just simply
Suicidal, yeah.
absolutely cannot put one foot in front of the other. And they've tried medications, and so often they say, I was on the medication, but I felt like a zombie. The side effects were so bad for me. It was like, which is worse? And then for some people, where DNA tests are done and then they dial in the medication, and I'm not trying to be anti medication here, but when you're talking about a non pharmacological, non invasive, non side effect, 80% efficacy, long term
Durability,
here,
yeah.
anxiety, depression, loneliness, stress are at the highest levels they've been probably ever recorded, according to the CDC and other agencies that have been surveying this type thing. I'm not saying if you go get TMS treatment that all of a sudden you're going to get your job back and your financial problems are going to go away, but you're going to be better equipped to cope with, overcome, look for solutions to, and deal with that. Because when you are depressed, you're not as cognitively efficient as you would have been otherwise. You're not as active. Your energy levels, everything goes down biochemically, physiologically, psychologically. Everything goes down when you're depressed. And if you're anxious, again, you're distracted. You're hearing a lot of noise and stuff. You're not nearly as efficient concentration wise because you have all this going on in your head. Now, you said if it weren't for the fact that these are a bit expensive, nationally around the country, what do these kind of treatments generally cost someone, and does insurance cover them?
Well, the good news is insurance is now starting to cover them. And so the Blue Cross and even Medicare are seeing the tremendous results from this. So this is, as we're speaking, they're becoming covered by insurance. When not covered by insurance, it's about $400 per treatment. So that's for a course of 30 treatments. That's quite significant for most people. And even though the benefit from that, they feel it, and the productivity, getting back to their life, makes it worthwhile. The medication is very expensive too if you're taking pharmacological meds for this, but it's about $350 to $400 a treatment, I believe.
Okay, so, and you're talking about 25 treatments.
I think it's about $7,000 for $7,000 to $8,000 for a course of treatment. Yeah.
Okay.
But insurance is going to come through, and we always help people as well. As you know, we often do it for
I don't know how you
nothing.
stay in business.
Yeah. Well, sometimes they're heartbreaking stories, and there's a tremendous good feeling for our team when we help people. So it's not always about the financial component.
Are there places around the country that do a good job on this?
Yeah, I think they do. And they use the traditional treatment. What we're talking about today is something that outside of certain academic and very specialized institutions are not being able to do, the targeted imaging-based TMS, where you're actually able to subselect areas of the frontal executive area and concentrate on those. So the traditional treatment that's been going on for 7 or 8 years is a general treatment to the general area. They get about a 58% improvement rate. And there are centers all over the country that do it without imaging guidance. Now, we will provide the imaging and send the database to the TMS centers, and there are plans to educate all those psychiatrists on how to use the imaging-guided system.
So the primary impact now is depression and anxiety.
Yes.
And, of course, that is comorbid to so many other things. So whether you're dealing with a primary diagnosis of PTSD or whatever,
traumatic brain injury,
or TBI,
or especially things like brain degenerative disease. Depression is one of the most terrible parts of Alzheimer's disease. And if you can get people out of that depression, you're stimulating neurological tissue in a patient with a brain that's degenerating. You can give them more time before they have their memory slip away. And
it's got to seem like it rolls the clock back.
Yeah,
I know it doesn't. I'm just saying.
It just keeps the neurological tissue regenerating itself. And in stroke and in multiple sclerosis now, there are also very big applications for this. So it's a big advance generally, and I think we're going to see a lot more of this.